Hello everyone, Dr. Anthony Lordo here, your go-to dentist in Worthington, Ohio. I've had a few questions shot to me via email lately, and one question was, well, Dr. Lordo, what is TMJ? Well, that's a great question, and boy, we could talk about that as long as you'd like, maybe a couple hours, but I was told to keep the video kind of short. So TMJ stands for temporomandibular joint. Well, that's the thing right here. People often will say, hey, I have TMJ. Well, golly, I hope you actually have two of them, one here and one here. What folks are really saying is, I think I have TMD. That's temporomandibular joint dysfunction or disharmony. And that can be broken down into three types of problems, in my opinion. And the most common, which about 80% of the population has, is disharmony between where your jaw joint fits best in the base of the skull, kind of like a ball in a socket, and when your teeth come together, they should all meet perfectly, equally, and evenly all the way around. Well, for 80% of us, that doesn't always happen. Sometimes you gotta kind of wiggle your teeth around with your muscles to make them fit quite right. When that happens, that can make the muscles very sore. So I see people say, oh, I think I have TMJ. Well, actually, you have really sore muscles here and even up here in the head. And that is typically because the muscles are working extra hard to try to make the teeth come together. When the teeth don't come together in perfect harmony, especially when you're sleeping, those muscles can go into overdrive and really clench and grind and try to work those teeth to fit together better, maybe grinding. Well, and there's even sleep apnea, which can make it worse. So the first type of TMD or TMJ disharmony or dysfunction is, muscular. Man, my muscles are just sore. I'm waking up with headaches. They kind of are like migraines sometimes. Well, the good news is, those are the ones that we can usually help you with. Sometimes a night guard or an orthotic, or sometimes smoothing the teeth called an equilibration, make them fit together better. Many times we can significantly reduce those headaches and really reduce the muscular discomfort that you're having. That's the most common. Then the second type is it's a disc displacement. What's that mean? Between the base of the skull and the condyle head, there's a little disc that rides between our lower jaw joint and our skull there, and that disc is kind of like the disc in your knee. And that little disc can rip, it can pop off, and it can tear, and it can wear out. And when that happens, boy, it can hurt higher, up here, actually in the joint by your ear. Well, that's not as easy to help as someone who's got a muscular problem, because muscles heal pretty easy. Cartilage, it just doesn't like to heal so well. But again, with proper diagnosis, imaging, like cone beams and CAT scans, we can tell, even with an MRI, where that disc is and come up with a game plan to hopefully get you feeling better. Sometimes we can, sometimes it's kind of hard. The third type, and it's my least favorite type of jaw joint problem, is called a degenerative joint disease, or DJD. Those are kind of sad. Why? Because instead of having a muscle problem or a cartilaginous disc problem, we have a bony breakdown of the jaw joint. And it's usually the lower jaw, kind of like a ball in a socket. Instead of that being a nice round ball, it kind of gets flattened out as it breaks down and hurts real bad. Sadly, those are the most difficult things we have to deal with. All those folks, and they feel like their bite's changing all the time, their teeth don't come together right. And a lot of times folks don't know they have it until we pick it up on an x-ray called a Panorex that goes around your head. And then we become a little bit suspicious that there might be more of a breakdown. And then we order a CAT scan of your jaw and have that read by a dental radiologist. And then they can help us diagnose just how badly that bony breakdown may be occurring. Again, it's very difficult to help folks when their bone starts breaking down. So, to answer your question, I think there's three types of jaw joint problems, or TMJD dysfunctions. One, simply muscular. And those are kind of easy to fix, and those happen about 80% of the time. Two, a cartilaginous disc displacement. Well, that's where that little disc pops in and out, or maybe is ripped or torn. And then three, true bony breakdown of the joint itself. And that's one of the most difficult things we have to deal with here in the office. So if you're having any of those problems, once we get back to normal here in the great state of Ohio, please give the office a call, and we'd be more than happy to do a nice thorough exam and help you co-diagnose, because we need your help in figuring out what type of TMD that you have. Again, this is Dr. Lordo, your go-to dentist in Worthington, Ohio, saying wash them hands and keep smiling.